Yes.
Hello everyone, I am Dr. Sneha Divekar and this is the second lecture of Sports Talk series. So today's lecture, the main topic is Sports Dentistry for Children, and we have our guest lecturer as the pediatric dentist, who is Dr. Nikita Kulkarni. Now I will introduce Dr. Nikita Kulkarni. Hello, good morning.
Hi, good morning.
Yeah.
Thank you for inviting me.
Yeah, most welcome. Dr. Nikita is a pediatric dentist. She is owner of the Little Tooth Doctor Dental Clinic in the heart of Pune city. She is experienced in treating all dental problems related to pediatric age group, including restorations, endodontic treatment, habit correction, and dental trauma management. She believes on focusing on preventive treatment of children using remineralizing agents, modifying their oral hygiene habits in early childhood, and encouraging use of mouthguards for trauma prevention for young athletes playing sports. She is attached as a pediatric dentist to various hospitals like Jupiter Hospital, Symbiosis Healthcare Center, Medipoint Hospital, Jumpstart School, O Hospital, Pune Hospital, Cloud9 Hospital, etc. She has conducted various health talks in different schools and daycare centers across Pune. She has attended various conferences, courses, and workshops to keep herself updated in different aspects of dentistry. She is also a life member of the Indian Dental Association and Indian Society of Preventive and Pediatric Dentistry. So, welcome, Dr. Nikita. It's really a great pleasure to have you on board.
Thank you so much. Thank you, Sneha, for inviting me today and for such a lovely introduction. So sweet of you.
Yeah.
Yes.
So I guess let's move to the topic. So I would like to, our main focus on today's lecture is two things, dental trauma and dental care and dental treatments regarding the children. Okay,
right.
So my first question to you would be, first question that is usually in every parent's mind, at what age do the permanent teeth start erupting and till what time do all the teeth come in the mouth?
Right. So yes, today we are touching a very good topic and often neglected topic of sports dentistry. And especially in children, sports dentistry all over in India and in Pune, of course, is practiced very less.
Yeah.
And that too amongst children, it's very less commonly affected. Yeah. As a pediatric dentist, I have faced many such cases coming to the clinic. But if they would know how to prevent these injuries, probably they could have been prevented. So that was the sole purpose Dr. Sneha approached me to spread some awareness regarding how to prevent these injuries. And then let's enlighten our listeners on that aspect. Coming to eruption of permanent teeth. So the permanent teeth start erupting from the age of 6 and the process continues till the age of 13. From the ages 6 to 9, the front 4 incisors erupt. These 4 incisors erupt usually during the ages 6 to 9. That is the age what is prevalent and dominant for dental trauma. During these age, when the child is engaged during different sports activities, that is the time when these would get affected. Followed by 6 to 9, the canines erupt, the upper canine erupts at the later age, followed by the premolars. The age to erupt premolar is between 10 to 13 years. At the age of 13 years, the second molar starts erupting. And later than that, that is followed by the third molar that is erupts at the age of 18 or plus than that. So the main age groups, what we should focus on is 6 to 9 for permanent teeth. And I would like to tell about primary teeth as well in this. Primary teeth start erupting from the age of 1, you can consider. So from the first birthday till 2.5 years. That is how it is spread. Again, these teeth come into 3 parts. Probably 1 year to 1.5 years. Then there is a gap. Then the eruption starts from again 2 years to 2.5 years. That's the second phase. And the third phase is 2.5 year plus. That is around the age of 3, the second molar erupts. So during this aspect, 1 to 3 years, that is also important for trauma perspective. That is the age when the children have just learned to walk. That's the toddler stage. So that is the time when trauma can be seen for the young ones.
Yeah. So coming to talking about trauma, basically.
Yes.
So tell us about 2-3 things I will ask you about dental trauma management in young athletes. Like, what to do if milk teeth are fractured or avulsed, because I think mostly there is a different, if the permanent teeth are damaged, there is a different protocol, I guess, and that's different with the primary teeth. So we would like to know about that. And what treatments will need to be done for, especially for the younger permanent teeth?
Okay, the immature permanent teeth. Yes, yeah. So I have a few slides showing that. Yes. So I was saying, out of children, almost 50% have had a traumatic injury due to sports by the age of teenagers. So these traumatic injuries are what we are focusing on today and how those can be prevented. These injuries can be divided into two parts, either for your primary teeth or either for your permanent teeth. So let's come first for the primary teeth. The age group what these children will fall is between 1.5 to 3 years. I won't say all these injuries would be because of sports, but those can be also because of mishaps, or like they are like trying to walk, they are trying to run, they are going to playground for their outdoor activities. So that is the time they tend to fall. The most commonly affected tooth is the central incisor, the one which can be seen missing in this child's photo. So this is a case of avulsion, what is seen here.
Right.
If such a case is reported, a milk tooth is never ever reimplanted back into the socket, but it can be replaced by some other aesthetic means, by some other similar tooth-shaped crowns are available in pediatric dentistry nowadays, which can be attached with the help of a fiber split. So that is what can be done. An X-ray examination is also needed at this stage so that it checks the status of the permanent erupting incisor. So these 2-3 things are taken into consideration where there is trauma to a milk tooth. So like I was saying about avulsion. So if the tooth has, this is only for a primary, this is just for a permanent tooth, not for a primary tooth. So if this takes place in the case of a permanent dentition, so the age group would be around 6 to 9 years. That time the tooth can be saved by the parents and it can be reported to a nearest pediatric dentist. So that is the time it is saved usually in milk or in saliva. It is never put it in normal water as it devitalizes the tooth. Such a tooth can be reimplanted if the socket is well preserved and the tooth is also in a very good condition. So these are some slides focusing that how to save your permanent tooth and how to carry it to a nearest pediatric dentist. If it is not a complete avulsion, if the tooth has not completely lodged off its socket, if it's just a fracture at the crown level or at the root level, there are various types of treatment which we give to permanent immature tooth. The root of the tooth will develop only after the age of 8 or 9 years. Until that age, if the child is reported to the dental clinic, you have to focus the treatment such that the vitality of the pulp is preserved. You don't want to make the tooth non-vital at such a young age. So to preserve the vitality, there are various procedures which are done, such as apexogenesis or pulpotomy. The pulp is preserved and the biocompatible material is placed so that the root formation happens naturally. If the trauma is more, artificial root formation can also be stimulated with the help of a root canal treatment, which is done in adults also. So the maxillary central incisors, the one which we can see in the slide, is the most commonly affected tooth during such dental trauma while playing any contact sports. So contact sports, basically what all in India these kids are engaged in are basically skating or also boxing, I think so. Or even football, right? All these sports when you are playing, so make sure if there is, in case of any dental trauma, you can report it to a pediatric dentist. So as I was saying, this is the central incisor, which is the most commonly affected 34% of the times. followed by the lateral incisor, and followed by the lower central incisors. So
the maximum chance the upper central incisors are having of getting injured.
Yes. Because of the anatomy like that, because the maxillary ones are placed forwardly. And especially if there is malocclusion, if these are naturally proclined. So more the chances these can get affected. So you can actually get treatment done for the proclined incisors also actually. So on the upper right side, this is a case of a milk tooth trauma, you can see. There is a fracture of the alveolar segment also. The tooth is intact, but there would be fracture of the alveolar segment. So just as to prevent these such kind of things, you can always encourage the use of mouth guards, which are coming to the.
I was about to ask you the same thing. That exactly. So it is really necessary to, I think, make coaches, parents, and athletes aware about mouth guards. So I would like to ask you here that what are the type of mouth guards, and what mouth guards are more suitable for young athletes, and also along with mouth guards, I would also like to know about what are the preventive treatments of dental decay in the younger athletes.
Right. So in case you want to prevent such traumatic incidences to your child, you can definitely make use of mouth guards, which are commonly practiced nowadays. Earlier, it was not much known, or awareness is still lacking. So that is why we are, it's our small help to spread this awareness. So mouth guards, 3 types of mouth guards are available. One are the ready-made ones, which are available over the counter. They come in 3 different sizes: small, medium, or large. They can be used for children below 10 years also. Those are directly fitted into the child's mouth while engaged in any sports activity. The second pattern is also quite easy to use at home only. It's a boil and bite pattern. It is made up of a thermoplastic material. So when inserted in boiling water and then put in the child's mouth, the indentations of the occlusal surfaces of the tooth come on the mouth guard so that it is fit into the oral cavity and it doesn't move. This one is better than the ready-made ones because it would have a nice fit than the
better fit, I think.
Yes, better fit. But if you want a custom fabricated one, that is also available at a dentist's office, at any pediatric dentist or a sports dentist office, which is made after making an impression of the child. That has an excellent fit, and it has to be replaced every 6 months or 1 year, according to the dentist's advice. These are few photographs of the mouth guards, and the custom fabricated ones, as I said, they have the best protection because they would have a very good fit. They are to be made at a dental clinic, and they are very easy to use. It doesn't cause any pain, or it doesn't. It's not harmful for the soft tissue.
And I think for braces, kids using braces also might need a specific mouth.
Yes, there are specialized mouth guards for that also, for using braces, because when children are using braces, that time they are more prone to get injuries actually, because the tooth is already weak. It might get an injury faster when there is fall. So that time also mouth guards should be used more actually. So mouth guards is one. Apart from that, routine dental checkups and decay rate to be minimized, to have a optimum decay rate is advised to the children, so that there is not severe any problem when the child has any dental trauma. Recalls after every 6 months are advised at a dentist's office. Also, for athletes, high decay rate is often observed because they often suffer dry mouth, because there are less chances they would have water at such frequent intervals as advised, because their play time is so much that they often neglect to have water. Along with water, natural homemade fruit juices are more beneficial than the artificial ones. All the energy drinks what are now available in markets, they contain a lot of fizz and aerated components, which cause erosions in the upper front incisors. So that is not advisable. Rather than that, lime juice, or a simple kokum sarbat, that would also be fine. Along with that, diet of an athlete is very important. It should be a well-balanced diet and not just containing of, I would come to the, I would come to this just a bit. The diet should be compromised of all the healthy components first, and then if at all the sweets and the otherwise junk food can be given on a one day probably, because you can't keep them away, but you can restrict it. On a day-to-day basis, you can have dry fruits, you can have homemade sweets rather than chocolates. That is how it can be done. So as I was saying,
we really need to retrain their parents and how they think about all these things.
Right. So even there is easy remedies to give in tiffins also. Nowadays they try to give ready-made food in tiffins, but rather than that, you can give a couple of dry fruits in that rather than to give a chips packet.
Right. True.
Even bananas are a very good, fast and instant source of energy for these children. Fruits can be given. Fruits can cause a natural cleansing action also, which that would keep the decay rate at bay. That would keep the decay rate minimum. So these are some food habits and prevention of dental caries. Of course, along with your routine dental checkups, brushing is very important right from the age 1. So that is how early brushing habits are to be inculcated. Twice brushing in the morning and in the night, and rinsing after every meal. That is also very important. If they are out and during their play, you can't go and visit the washroom every time. So during those times, the child can use a drinking water to just rinse after he's had his small snack or whatever tiffin he's carrying, so that the food is not getting stuck. So rinsing is also very important after every snacking, not after every meal, but also after every snack.
I think that is the most important thing, because people just think that brushing twice daily is enough, but I think they forget about what the frequent snacking the children do, especially in sports, I think.
Exactly. Probably they have a break after 1 hour, so that is the time they eat, but they forget to drink water. Or while drinking water, they can just swish the water in their oral cavity and gulp it down. So there's no need to spit also, because it's just drink.
True.
Along with that, when you visit a dentist 6 monthly, that is why we emphasize a 6 monthly dental visit is required, because we usually advise some other forms of oral hygiene which will prevent dental decay or which will make the existing teeth a bit stronger and decay resistant. How does it make it decay resistant? Is by the use of fluorides. Fluoride is present in our normal toothpaste also, but in our professionally applied fluoride pastes, the concentration of fluoride is much more, so that the tooth is a bit decay resistant. It becomes more harder, we would say, or it would also remineralize the incipient lesions. The incipient carious lesions can also be remineralized by use of fluoride applications. Kids toothpaste, if less than 6 years, those also can be used, which are flavored, but I would recommend a fluoridated toothpaste for kids also. Don't go to use a non-fluoridated one, because according to the newer norms, a fluoridated toothpaste is more advisable. These are some treatments which we do at the dental office as a preventive therapy, so that the decay doesn't progress. This is one kind of a pit and fissure sealant treatment, which is done for the back teeth, the permanent first molar. These teeth usually erupt at the age of 6. So from that time onwards, you can start visiting a dentist, so that the decay rate is also at bay. It is at minimum. This is a very painless treatment, which is usually done at any pediatric dentist, so that this decay, which you can see in the
just started
enamel region, it is just
stops there.
It doesn't prevent further. It doesn't go further.
Okay, that's really great, and it's really an amazing lot of information. We'll definitely circulate this to all the parents and coaches and teachers, because I guess they are the ones to whom this information has to go. because
Yes.
not just the kids, the young athletes or the people around them, they need to know all these small things regarding
Right.
dental care and trauma prevention and management. They need to know all these things. So
Right.
definitely it was
Right.
a nice, it was pleasure listening to all the small important points and inputs that you have given for both dental trauma and dental care for children. And definitely, I think sports dentistry is coming up in a big way in India now. So, and with the increasing number of athletes playing sports, it has become more and more important to focus on their oral hygiene habits, dental care, how frequently they are visiting the dentist, and how properly they are maintaining their oral hygiene. So,
Right.
yeah.
Right. Thank you so much.
Yeah.
If someone wants to see the pictures of the mouth guards, we would just keep this, because this is something new, and many of the parents, many of the dentists also, I think so, they don't know yet that this is to be recommended. So there are very simple 3 types of mouth guards which are available. So you can counsel your patients, adult patients who are coming by. We usually know our patients quite well. So if their child is already engaged in a sports activity, we could definitely recommend them. That is how I think so it will spread.
Yeah. It will take time, but it will happen.
Also on playgrounds, the coaches should be made aware that such things are available, so that they can avail, the children can avail. And from us only, it will now start spreading.
Exactly.
At the end, it's mouth-to-mouth publicity about all newer things in dentistry.
Not just the parents and athletes, but I think the dentists also have to be made aware of all these things.
Yes.
Yeah, because they finally are going to advocate this to their patients.
Yes.
Okay. So yes, we are come to the end of this second lecture on sports dentistry in children, and please stay tuned for our further lectures. We will be bringing more and more different interesting topics regarding various aspects of sports dentistry. So this is Dr. Sneha Divekar along with Dr. Nikita Kulkarni, and we are signing off. Thank you so much.
Thank you so much. Yeah. See you.